My name is Linda Clemente. I work inpatient primarily at HeathSouth. HeathSouth's acute care rehab, but we also have an outpatient department, and I do follow up with some people that are seen as outpatients. We also have an outpatient speech therapist, occupational therapist, and physical therapist. Basically, occupational therapy, as you see, it's an allied health professional, and our primary goal is to have a person reach their highest level of independence in their ADLs, or their activities of daily living. That's the thing that sets us apart. All of us as therapists have the universal goal as having a person be as independent as possible and going home. As OTs, we're uniquely responsible for practicing the everyday things like eating, grooming, dressing, bathing, but also going on to pre-vocational skills. Even OTs work as work hardening, working as if it was a child, on their play activities. It really depends on the age of the client and the setting, but we want to make that person as independent as possible, goal of returning back to their life. Again, it's to return to a most productive, as satisfying life as possible. What do we do? The first thing that we do, like every other discipline, is look at the client, and we're looking specifically, not specifically, but we focus on arm and hand movements only because as OTs we usually use our hands to get through the day for our ADLs. We're with the other team members coming up with a plan of care that's going to get that person to develop, restore, and maintain the person's ability to accomplish the ADLs. You need to have basic motor function to participate, and we're also looking at a person's reasonable abilities, cognitive skills. An important part of our job is providing education to family members and or caregivers when a person has to compensate for a loss of function. The goal is to have the person get back and regain strength, but also teach new techniques of doing things if in fact they're not able to reach their exact pre-level, pre-injury, pre-insult. Fundamental concept in OT is that the activity or the occupation be interesting and must intrinsically promote the correct movement or cognitive behavior. We don't just randomly give out exercises and activities. There's purpose to the way we do things, and it's based on a person's age, what their goals are also. It changes person to person. Some of the goals that we might be working on is working on upper extremity or arm strength and range of motion, gross and fine coordination, dexterity, being able to manipulate tools. Again, going into if someone's looking at getting back to work, what exactly the skills are needed to get back to work. Looking at transfer skills, how somebody goes from sit to stand, how they get on and off a toilet, are they able to go in and out of a shower, a car transfer. We're looking at balance, specifically in brain injury, where deficits in balance can make somebody safe or very unsafe. We're looking to improve static and dynamic balance. Assisting in normalizing sensory deficits, which are also pretty common. An area that we focus on as OTs, improving visual perceptual skills, which Dr. Gordon got into a little bit, improving cognitive and executive functioning, the higher level skills, judgment, abstract, doing mental math. We're looking at that kind of issue usually as someone becomes an outpatient. As inpatient, it's much more the first, as an acute care, people are there maybe 2, 3, 4, 5 weeks. So it's more motor movement and sensory tend to work on higher executive functioning as someone becomes an outpatient. And of course, what makes us OTs are having somebody be as independent as possible in ADLs.